Good morning, everyone. Thank you so much for your time today and joining us in the virtual College Comeback Week. It is a pleasure to assist you, and we are ready to connect you with the team that can help you come back successfully to Tri-C. My name is Eunice Cabrera, Retention Project Manager at Cuyahoga Community College, and one of my primary responsibilities is to help former Tri-C students come back and stay and eventually graduate, celebrate with you, and your career accomplishments. So now I have the pleasure to introduce our guest speaker, Bud Madison. He is the Health Professions Recruitment Specialist at Cuyahoga Community College, and he will be sharing important information about the programs, about how to enroll, and all those important things to help you be successful. So I would like to remind you that during the presentation, if you can keep your microphone muted so everyone can hear the information, feel free to raise your hand or type your questions and comments in the box, in the chat box, and we will be happy to answer those questions. But again, I just wanted to remind you that we are here for you, and we will be happy to help you achieve your educational goals. So now I'm going to pass it on to the Bob, and we take it from there. Thank you.
Thank you. Thank you so much, Eunice. It is a pleasure to be here. And I want to thank everybody who either is in attendance now or maybe looking at this recorded as a recorded version. As Ms. Cabrera indicated, my name is Bob Madison, and I'm the recruitment specialist for the over 30 different health career programs that exist at Cuyahoga Community College. What we're going to cover today a little bit is about some of the programs. We'll talk a little bit about the program offerings. We've had some sunsetting of a couple different programs that are no longer available. I want to talk about a new process to get students, and it's going to be an easier process than the old way of applying to the program, but a process that will be interactive and allow students a lot of really good information to know where they're at, what they still have left to do, and contact information regarding if they need help. But I'm going to try to share my screen. A lot of people say, why would I want to go into health careers? I'm not, I'm not a blood, guts, and gore person. I, cringe at the sight of blood, or it's too hard. There are too many classes that I would have to take that are like biology and, chemistry and things like that. With over 30 different health career programs, you can find a home. And if you were a student that previously met a roadblock where you pursued a program and maybe the prerequisites and you hit a roadblock, you hit something that you just could not get through, there are different avenues and different end results that you can get to that will put you on a track to have a career in the healthcare field. So if you started off as a nuclear medicine specialist and then you realized, oh boy, I have to take physics, and it didn't work for you because your brain just doesn't work like that. I know I would have problems with a physics course. There are courses that do not programs in our area that do not require that prerequisite. So I have some information to share with you, and I'm going to share my screen, and I haven't done this in a little while, so we're going to hope that this works. And Eunice, you'll have to let me know when.
Sure.
See.
Yeah, we are able to see your screen.
Excellent, excellent. People wonder, it's sort of like what is right in front of your face or right underneath your nose sometimes is very blurry. And people who are living in Northeastern Ohio sometimes don't realize that they are living in a world capital for healthcare. And there are a lot of reasons for that. People come from all over the world to get treatment at our facilities. Some of the facilities that are in the greater Cleveland area are listed on this screen. There are many that are not. But consistently, Cleveland is ranked as an area that is one of the strongest, if not in the country, in the world for healthcare and treatment. And if you can see the little stethoscope with the paw, not all health care has to do with humans. We have a veterinary technology program, and there are too many to list ways in which you can get involved with that. Medical Mutual is an insurance benefit. A lot of Tri-C employees get their benefits through, their health benefits through Medical Mutual. And there are a lot of Tri-C graduates who end up working for companies like Medical Mutual, who have been through programs like our health information management technology and medical coding and things like that. So it's a really great place to start and to continue if you're looking to find a way that isn't going to be affected by unemployment. The health career areas in Cleveland are not. And many, if not most of our graduates from our programs have multiple job offers before they graduate. And I have many examples of that, but we'll continue on because I could go on and on and on about why living in Cleveland and why pursuing a health career field is a very smart idea. Okay, next slide. This is a listing of our Associate of Applied Science Health Career Programs. There is a space here underneath the Diagnostic Medical Sonography program that listed dietetic technology. We have sunset that program, meaning that we are going to graduate the people who are in the current program, but we are not taking new applicants for the time being. That's not saying that's sometime in the future, the program may come back, but at this time, that program is not being offered. But these are programs where we have 2-year Associate of Applied Science degrees. EMT is on all of our campuses. And it is also offered as a certificate. Many of these programs have certificate options, and some of them have what are called stackable certificates, where you can do either like a 1-year certificate, and then at that junction, when you are ready to graduate with that 1-year certificate, you can decide, do I want to take that certificate, that certification, and go off into the workforce, or do I want to continue on, add another year, and receive not only the certification and the certificate that would come with your first year, but also your associate degree, your college degree. So a lot of people may be thinking, I'm not so sure I'm ready for the 2-year associate because I'm not sure whether it's timing or whether you need confidence, or you just want to see whether you can master the first year before you look at the second year. That's fine. You don't have to make up your mind in the beginning. For many of these programs, it's a decision that you can make at the end of your first year. Health Information Management Technology is a program that is a gigantic program in the industry. I can't say enough great things about it. It's underutilized as far as our students go. You can work from home. As far as when you work, you can take the program online. It is offered in person at the Metro campus. And we feed, the last I had heard, there were like 38 different job titles that an associate degree in HIMT prepared you for legitimately applying for, and legitimately being ready and totally ready to take on that job, 38 different jobs that are within a healthcare field, be it working at a hospital or an insurance company, healthcare insurance, working for an offsite clinic, working in doctor's offices. A lot of what you can get is working in medical coding, and you become an expert in that with the 2-year degree. And I know somebody who graduated last spring. They were able to get licensed in the HIMT field before they graduated. And HIMT, Health Information Management, has a policy that if you get licensed before, during your final semester, you do not have to take your finals for that semester for the classes that you're enrolled in, because you already have that ticket or that license to go and apply. This person then went on, she had several job offers to choose from. She ended up taking a job with University Hospitals, working as a medical coder. I've spoken with the person recently, and they are ecstatic. They're working from home and they're making, well, I don't know exactly how much, but I know that it is a nice salary. Coders are in need. And that's just one example of that program's results. And not enough people know about that program because it isn't as easily shown off as maybe radiography, where we have equipment, or phlebotomy, where we're showing somebody injecting a needle into a fake arm to learn how to find a vein and things like that. So I feel better about having talked a little bit about that. Human Services is another non-blood, guts, and gore program where you are not really dealing with health in as much as you are working with clients, people from the community, and in one way, shape, or form, you are trying to connect them with agencies or ways in which programs out in the community, be they local, state, or federal programs, connecting them with resources. And that is a 2-year degree at Metro Campus. Massage therapy is offered at our Eastern Campus. Again, it's a 2-year program, but there's also a certificate option. They have an on-site clinic where students will get exposure to working on real people. So you can get like a massage for a very, very low cost, a medical massage. And they do this and they make money with it to support their program. But it's a really, I hate to say hands-on. Massage therapy is pretty hands-on. But it, a very popular program. And we see a lot of students attracted to that. Medical assisting is one of those stackable certificates. And I mentioned that, where you can do your first year and either decide after first year you get certified as a medical assistant. You can decide, hey, I'm going to go off into the field, or I'm going to continue on for another year. With that additional year, you also become certified in phlebotomy. So phlebotomy, which is drawing blood and being licensed as a person who can do that, is included in the 2-year Associate of Applied Science in Medical Assisting. And that's part of that stackable certificate. So when you graduate, you have 3 credentials in medical assisting. You have certification in medical assisting, you have certification in phlebotomy, and you have you have an associate's degree, an Associate of Applied Science degree in medical assisting. All 3 things you can list on your resume when you go in for job interviews and you're networking and seeking employment. We are also hopefully real soon looking at adding some components to that as options. Dialysis assistant is something that we are looking at in a few other areas, so stay tuned. We're going to hopefully add to the options for medical assisting and ways in which you can become, well, you can add more feathers to your cap as you look for employment. Medical lab tech is if you're not so much wanting to work with patients, but maybe work in a lab, maybe as a scientist mode, where you are doing tests on blood samples, urine samples, hair samples. You're working in the back lab, you're working with high-priced machinery, fluid separators, you're working with microscopes, and you're taking what is ordered, labs that are ordered by the doctor, and you are doing those tests. And then phlebotomy is part of the MLT program right now. And at some places, you would be the person, offsite labs, you would be the person who might do the actual blood draw, and you would then go and do the test on the blood. And that is, you can make yourself really marketable if you have both of those credentials, because those are two things, two for the price of one. I guess if when someone hires you to do a job at an offsite clinic, if you can do both, you're looking good. But medical assisting is a strong program. All of these programs, medical assisting is an accredited, regionally accredited, nationally accredited program. All of our programs have professional accreditation, meaning that they have the highest level of approval from the industry accrediting bodies that come on site and really look through every nook and cranny, really look at what you're producing, the equipment you use, the faculty who teach the programs. Everything has to be at the highest level. So we pride ourselves on having that level of professionalism so that we know our graduates are going off. And it's, hospitals like UH or the Cleveland Clinic or anybody else can assume, hey, these graduates are coming from the highest levels, highest standard education level. They're going to know what they're doing, and they're going to be able to hit the ground running. Nuclear medicine is one of those programs that is high science. I would think that as you look at the word nuclear, you would assume that. They are working with radioactive pharmaceuticals, radioactive medications, and injecting them into patients. They then will do a scan where they can multiply or magnify, I guess is the right word, a body part that, at 1 million times, and determine at a cellular level whether something is going on or whether it is not. They can determine things like cancer, or if a person has had a heart attack, or if there's arterial disease, things like that. Nuclear medicine is only a 2-year degree. It is offered only at our Western campus. And we'll talk a little bit about prerequisites as we go on, but prerequisites are, they differ for each program. And for nuclear medicine and some of the other Western campus programs like sonography, radiography, electroneurodiagnostic technology, these are programs offered at West in the healthcare field, and they are a little bit more difficult because you're dealing with higher levels of technology. Nursing, I don't cover the nursing program because at this time, nursing is their own entity. So anybody who has questions about nursing, what they recommend highly is to go to their website, which is try-c.edu/nursing, and look for the information on their information sessions. And that's where there are so many people asking questions about nursing that they want to get as many people in one room or online and address some of the commonly asked questions, and then you'll have a chance to ask questions at the end of it. So that's how they deal with how they handle students with questions or students who just want to become familiar with the process. So that's what I do when a student asks me about nursing. OTA, occupational therapy assistant, technology, and physical therapy assisting are brother-sister programs here at Metro Campus, and occupational therapy has to deal with the non-physical trauma side, the rehabilitation of maybe somebody is in an accident, they break their arm, and an arm is put into a cast, and when they take the cast off, the arm or the shoulder does not operate the way that it used to. There was permanent damage, and an occupational therapist will help patients relearn or learn new ways to do things that they normally did in life that maybe because of the accident or because of the trauma, they're not able to do it that way anymore. So an OTA occupational therapist assistant is a licensed professional as well as a physical therapist assistant. And OTAs deal with a lot of issues dealing with anger, self-esteem issues, depression. So there will be good resources to advance people who may need counseling. And you're taught a lot about that in the program, but it's just helping people get back to normalcy or as close to normalcy after a traumatic event. That's what OTA is, and it's a great program. It's here at Metro, and it is a 2-year associate's degree. Physical therapy is the physical side of that. So when they take that cast off of a broken arm, the arm may not rotate or may not stretch because it's been in a cast for 3 or 4 months. And a physical therapist assistant will work with a person to do exercises and to do therapies to get that arm as close to stretching full range of motion as possible. So, and you can do physical therapy on every part of the body from the tip of the head to the tip of your toes. We have an on-site clinic here at Metro Campus where our students in both these programs work with the community in real appointments overseen by licensed professionals. And as part of their education, they are actually doing what they are learning, as well as practicums going off into the field. All of our programs have practicums or clinicals, which is coursework that is not at Tri-C. It is coursework that is participatory. You are there at the hospital or at the clinic or at the agency, and you are practicing what you have learned. And it's real life work experience, and it's a great opportunity for networking. And OTAT, and which is occupational therapy, and PTAT, physical therapy assisting, are programs that have the availability, like massage therapy, of that on-site clinic where we're not sending you out, we're bringing patients into a real life clinic. So it's a great opportunity. Some of our newest facilities at Tri-C are our physical therapist assisting and occupational therapy assisting program facilities at Metro. I mentioned radiography. That's X-ray technician in layman's terms. Again, a little bit higher science programs. They teach not only how to use the equipment, but you have to be a people person, because people come into the X-ray lab typically not happy. They hurt, they may be broken, and so they may not be in the best of moods. So it isn't just the high science that we're teaching, as well as far as the X-rays and what is happening in taking an X-ray, but it's also accommodating the patient, being nurturing and being caring and understanding what they go through. So that a lot of that is taught. Also, very like nuclear medicine, safety precautions are taught at the highest levels. So when you're doing things like shooting gamma rays into a person, X-rays into a person, you have to have the latest safety equipment, knowledge, everything for both you and the patient, and that is taught at the highest levels for our programs. Optical technology is here at Metro, and that is dealing with eyewear and the eye. That is a stackable certificate as well, where you can get ophthalmic medical assisting, which is working in a doctor's office that deals with eyes, being an assistant in dealing with the equipment and the test when you go for an eye test. And then optical is working in a place where they get you a pair of glasses and they make you look good. So there's a little bit of art involved there, a little bit of fashion, but also, okay, how do you grind the lens? How do you get what prescription, when a person gets a prescription, how is that done? How does the equipment work? So our optical program, the 2-year associate's degree, is a great program to get you immersed in all of that and to go to work in an optical, in a whole bunch of different optical environments. Mentioned physical therapy, radiography, respiratory care is at Western Campus, and it is a higher science program as far as both prerequisites and the program requirements. And like during COVID, a lot of people on the news indicated that the people that they were showing were nurses, all of them. And what we came to find out that many of the people that they looked like nurses, many of them were respiratory care therapists during COVID and dealing with breathing problems. A respiratory care therapist trained at Tri-C is going to go to work on people who may have a bad cough, all the way to end life stage emphysema, lung cancer, things like that. Anything that affects the breathing. They are also involved with operations and dealing with respiratory, making sure that oxygen is provided, things like that. And so it's an exciting, fast-moving field of a 2-year, only offered as a 2-year associate's degree at our Western Campus. SCS, or Sports and Exercise Studies, is at our Eastern Campus. So if you have kind of an athletic itch and you don't know how to put it to work, and you're saying, boy, I was a star athlete in high school, but not good enough to really play at the highest levels in college, but you still want to be a part of that, there are ways that you can take your interest and your aptitude and go and get a stackable certificate or a 2-year associate's degree in sport and exercise studies, maybe coupled with a coaching certificate or a certificate in fitness training, or there's a variety of different ways, and then craft your own career path. And many of our people will go to work in colleges, in the athletic department, in some of our minor league squads, and you can work for all intent and purposes for a pro team. But usually they'll take people with a lot of experience, so you probably have to pay your dues before you get to the Cavaliers level or the Browns or level. But yes, a way to take your interest and turn it into your passion and turn it into something that pays the bills. That program is available at our Eastern Campus, but courses can be taken in that program at all of our campuses. Surg Tech is a program where, if you've ever thought, a lot of people come to me and say they want to be a neurosurgeon. Well, that takes so many years, it makes my head spin. So if you have an interest in that, I don't say stop your passion or stop your drive to become that, but also know that there are ways you can get into the operating room without having to go through the 10 years worth of education that would be required to be a top-level neurosurgeon or surgeon in general. A surgical tech works, basically they are the master of control in the operating room. They are going to account for all the instruments and all of anything that is used, and they run the operation. Basically, they work with the team, the surgical nurse and the anesthesiologist and anybody else involved with the surgery. They are going to run the surgery, and so it's a pretty important position. You never want to leave anything behind. That's why it's a strong component of this is paying attention to what you're using at the beginning and making sure you have the same number of things either disposed of, like gauze pads to clean something up, or instruments. Never want to leave anything behind. That program is at our Metro campus, 2-year associate's degree. Vet Tech is working with animals, and the only bit of advice I want to tell people, usually people come to me and they are either very, very knowledgeable about what Vet Tech is, or they understand there is this component of, wow, I really like animals. So my first issue of information is, in this program, and as a trained vet tech, you are going to have to eventually put down an animal. So if that is outside of your whatever ethics or the way that you deal with life or your feelings, a lot of people would not be able to do that. Now, if you're able to conceptualize that's an animal that is struggling, okay, that is the first mental hurdle that you have to get through. Vet Tech is doing a lot of different programs that we offer at the human level and combining it into 2 years for the animal. So I didn't mention diagnostic medical sonography. That is another program at our Western campus where we shoot sound waves into the body, bounces off a part of the body, and then it's recorded in an image, a moving image. Well, in vet tech, they do that with animals, and you're taught the very basic sonography principles. You're taught the very basic X-ray principles, drawing blood on an animal, which is phlebotomy on an animal. So a lot of what we have whole programs for at the human level, vet tech crams all of that into a 2-year Associate of Applied Science degree. I never want to say it's a hard program because my hard may be your easy and vice versa, depending on what we like and what we're strong in. So I would just say that all of our programs can be challenging. They are challenging. They would be challenging to me, but they're doable. They are doable. I'm going to go on to my next slide. My next slide. We also have certificate options, and I've mentioned several of these. You can take a look. We have a paramedic certificate, which is kind of a stackable with an EMT basic, 1 semester EMT basic certificate. You then can take a 1 semester anatomy course and a CPR course, and then apply to the paramedic program and attach your training. Then if you want to become a firefighter, we have a degree in, an actual program in fire. It's called EMS Fire. So you get basic EMT, paramedic, and the fire academy all put together in one with a ribbon on it. Some of these other programs, Health Unit Coordinator is offered out of our Health Information Management, a program that you can a lot of times work from home. Well, actually not Health Unit Coordinator, that is working in a facility, organizing a unit in a hospital. But our Medical Billing Specialist program, you can work from home, and that's working as a conduit or as a middle person between maybe a hospital and the insurance company and the patient, and making sure that things are coded and things are, when a person gets billed, that it's correctly billed. And you may talk with patients on the telephone occasionally, but it's not direct patient care. And that's a short-term certificate. You can do it all in 1 semester, or you can do it part-time. Let's see. Sterile processing is part of our surgical technology program. That's just making sure that the hospital that you work at is equipped with sterilized instruments. Anything that is reused, test tubes, any type of equipment, any type of surgical equipment, making sure that it is absolutely sterile for the next usage. And the distribution and sterile processing and distribution, it's just distributing everything back to where it is needed within a hospital setting. And that is a 1-year program. Typically, that program is offered in the evening or in the latter part of the afternoon. So it's good for people who may work during the day. I mentioned a lot of these other options. We also have post-degree for people who have degrees or advanced certificates. We have areas that you can add on. But I won't spend too much time on that. I'm going to go to, a lot of people are like, okay, how do I get into my program? How am I going to get help? Where am I at? Prerequisites. What am I doing? This is all confusing. Well, we heard you, and we have put together a new way of doing it. The process has actually won the Innovation of the Year award on a national level. And this process is a way to take people who are interested in a program and get them moving in a process that they get feedback from us constantly, or basically all the time. And they always are going to know where they're at, what they still need to do. And, if I'm struggling in a program, resource information. Okay, we see that you haven't passed a course that is a prerequisite. We may want to connect you with maybe Bob Madison. You may see my name. But what we're going to do, I'll talk about this process. But this email address that you see on your screen, trident.edu/HC, is the start area or the start point in which you can become integrated with our system or entered into our system. The other way to get it done is when you reapply to the college, which you may have to do as a returning student, indicating a health career. Now, if you don't indicate a health career, you can go to this website as long as you have your S number and you are ready to go with your MyTriC space. You need to be logged in MyTriC space, and you're going to go to this web address. So you plug that into your browser, and what will pop up will be this form. And you see my information here. When you go to this website as a logged in person in MyTriC space, your information will be here. And there will be an option below this. This is just a screen grab, but below this, there'll be an option to add another email address or another telephone number if there are better ways to communicate with you. But this is automatically generated, and this is what pops up when you go to that website. The other thing that is really important, and all of our programs have it, is a prerequisite, which is I have acknowledged the need for a background check. And that's what this is. This comes a little bit further on in the form, and this is just a piece of the information you read. And then you click this, I acknowledge the above statement. Real easy to do. You click it and it lights up, and then you type in your name. And that tells us you have read this and you understand eventually, not right away, but eventually you're going to have to do a background check through the company that TriC works with. You typically do not have to do that until the spring of a fall start of the year that you're going to start a program. So that's what, when I say a background check acknowledgement, don't start your background check. Wait until you're told by the program director. Next, you're going to come across, first off, I plan to start. If you have an idea of when you would like to start, you can indicate that. I'm not looking at that, because basically it is going to be determined by when you're done with your prereqs and when the next available cohort start is. So we have that, I think, for other reasons, but you have to indicate an answer on all of these. This is important. This next portion, choose a program or programs of interest. If you have one program that you're interested in, that's cool. Just indicate that one program. If you have several programs, you may want to whittle it down to 2 or 3, because what is going to happen after you submit this form is you're going to get emails from all of the programs. First off, welcoming you. Second off, telling you what the prerequisites are, telling you a little bit about the program, what your next steps are going to be. So these are all the correspondence are going to be sent to your TriC email address. So when you click submit, make sure you don't have all of these checked, because your inbox will be inundated with information on all of these programs. If you're unsure about it, do a little research. Go to YouTube, find out what a profession is. Go to the website for the program, and I'll show you some contact information for those programs about how to do that. But 2 or 3, 1 preferably. That way it focuses you into our system, and you're going to get, every time you complete a prerequisite for a program that you indicate here, you complete English 1010, which is a prerequisite for all of our associate degrees. You're going to get an email saying, hey, congratulations, we see you've completed English 1010. Here are the other prerequisites you still have to go. Continue on, good luck. If you have more questions, or if you're running into a problem, let us know. But yeah, that's the process. At the end of the process, you'll get an email also saying, hey, you've completed all of your prerequisites. So you have to check your TriC email account. You have to. And the email that goes out will say, hey, you've completed all your prerequisites for the diagnostic medical sonography program. Your file is being automatically transferred to the program director. The program director is going to go through a final review and will let you know if there are additional steps. Some programs have additional things you need to do. Many programs do not. They will just reach out to you and say, hey, you're done with the academic prerequisites. We would like to put you into a cohort. We'd like to offer you a spot in the program. So you're going to want to check your emails, your Tri-C emails. There's also a way that you can find out how to transfer or forward your Tri-C email to another email account that maybe is easier for you to access. But make sure you do that, or this system is not going to work if you don't check your Tri-C email addresses. Go to the next. This is basically a process. It's our old process, but the old process is the new process minus the technology. You complete your prerequisites, and basically, instead of applying for the program down here in step 4, your file is automatically going to the program director once you complete your prerequisites. If you're unsure about what you want to do, there's exploration. There are different things you can do. You can meet with me, and I'll show you how to do that. But there are different ways that you can start. You can start totally, I'm dead set on what I want to do, or you can be, I have 2 or 3 ideas that I'm thinking about, or I may be totally open. You can start in a lot of different places, and there are a lot of resources to help you narrow it down and get you focused in that direction. You need to apply or reapply and get all of the onboarding stuff done. Most of our programs require high school transcripts, so if you haven't done that already, make sure that you get your high school transcript showing a graduation date or a GED equivalent sent to our registrar's office. And the high schools would know how to get that to us. But you can take a look at this. This program, or this page, is available in the brochure for Health Careers, and it is available at our Health Career website. And I'm going to show you in a minute how to get to that. Now, I want to find out what my prerequisites are. You can go to the individual program website, either through our brochure, which lists all of the program websites, or through our Health Career website, which is tri-c.edu/health careers. Pretty much all Tri-C all Tri-C websites start with tri-c.edu and then a slash. And for Health Careers, to get to the Health Career webpage, /Health Careers. And then it'll say associate degree, certificate. You can click on one or the other. I'll show you a screenshot on that. And then, well, actually, the screenshot was shown earlier. I showed you the programs. Those were clickable links that get you to an actual website for the program. But in the left-hand column is where you're going to find either the word prerequisite or admission requirements. You can click on that, and that's going to tell you what are the courses and other things that I need to do in order to be ready and eligible to get into the program. Now, what a lot of students will forget is something I call fine print. Fine print is not just this stuff up here, which is the list of courses, but it's also stuff, and it's not so fine, but you're going to have to do some reading and make sure you understand that there are conditions for, some rules as far as some of the coursework you're taking as a prerequisite. Some programs have, if you're transferring in coursework from another institution, there may be, in this case, this is for, I believe this is for dental hygiene, there's a 5-year limit. So after 5 years, if it's a transferred course, or if you took it at Tri-C 5 years ago, and it's going into the 6th year, you will have to take that course over with, because there's a 5-year age of credit requirement. That's something that, I get a lot of tears. What do you mean I got to take the course over? Well, yeah, it was on the website. It was in prerequisites, and I'm sorry you didn't read it. There are some repeat clauses. The programs that have repeat clauses in the sciences our dental hygiene, sonography, nuclear medicine, occupational therapy, radiography, respiratory care, and MLT, medical laboratory technology. Those programs have some sort of repeat clause that says if you repeat a science course more than X number of times, and you have to go to the website and find out whether it's two, typically it's two. You have two chances to get through a class to meet the grade that is required. If you do more than that, you're going to be ineligible for the program. Now, if that's happened to any of you already, and maybe that's the reason why you didn't enroll, maybe you stopped out because, oh my goodness, that roadblock, the roadblock where you hit the roadblock and you're like, I can't get through this class. Come see me. And I'm going to show you how to do that and ways we can do it. But come see me because we can get you into a program that doesn't have that requirement. And you will not have to take that course in which you could not get through, no matter how hard you tried. It's not a failure. It is just our brains are wired differently. So if that happened to you, and the reason you're not at Tri-C because you ran into that wall and you can't get through it, come see me, talk to me, and we can get you back on path to maybe something that will put you into the environment that your original program was in, but it isn't quite as nasty of requirements as some of our programs may be for you. You may not have to take, you're like, I use the example of nuclear medicine. You don't have to take physics for most of our programs, okay? You do have to take a lot of, some biology coursework, anatomy and physiology coursework. There are some programs that have very little biology, just basic stuff. And we can connect you with that program. And if you got through things like English 1010 or maybe a college level math course, but it was the biology course that got you into trouble, maybe AMP 2, anatomy and physiology 2, or something else, we can find a program where you can utilize those prerequisites to advance you, to plug them into the new program so you can utilize them and it won't be time wasted for you. We want to keep you in the health career or health professions community or family, because obviously you may pick working in health careers because you like working with people or you like some aspect of it. You have to have a passion. So if you don't have a passion and you pick health careers, find that in you, find the passion, because you need that. You need it to get through hard times within the program, struggles, organizing your life, prioritizing, things like that. And if you have a passion for why you're doing something and what the end result is, it's going to be so much easier for you. It's going to be so much easier for you because you know why you're doing it and it's real important to you. But yeah, going back to fine print, very, very important. Make sure you read that so there are no tears at the end of the, what do you mean? I took the course 3 times and I can't get into the program. Yeah, it was on the website. There's some resources. The health professions website, which I mentioned, this is a way to get the listing of the programs. We divide them up both into certificates and associate degrees, as well as 3 different areas: support care programs, direct patient care programs, and diagnostic care programs. And diagnostic is some of those West campus programs where you are actually doing scanning, radiography, sonography. We have a program called electroneurodiagnostic technology where they're dealing with brain waves. It's a fascinating program. You're dealing with the central nervous system and doing nerve conduction studies. That's a program which is a diagnostic program. But yeah, we divide those programs up and we give you the option to click on to find out which programs may be direct patient care. maybe I want to be a nurse, but I couldn't pass some of the tests that they have, or I couldn't get through some of the coursework. Maybe we can get you into a medical assisting program that may be close to what you're doing in nursing, but it's just a different, I use the word paradigm. That's your lens that you look through life. You're just shifting the way your career is looking at a patient. And nursing deals with one paradigm or one lens, and we may shift it to maybe we want to go into respiratory care therapy. Maybe we want to go into medical assisting, maybe physical therapy assisting, where you're dealing with patients on a day-to-day basis. There are different ways that you can take what you have an interest in and take it in a direction that may not be nursing. So many people know about nursing and come to me about nursing. I would say 90% of the people at a college fair that I may go to are going to ask me about nursing because they don't really know that we have over 30 different areas. So you now know that we have these options. If you didn't know already, you now know. And if it was nursing that you were interested in, wonderful. Go forward with it. I'm not talking anybody out of that, but know that there are other options. Okay. The counseling center is a link. We recommend, as part of the process, that we highly recommend that after you are admitted to the college and you make your decision about, okay, I'm going to either be, narrowed it down to 3 areas or maybe definitely 1 area, make an appointment with an academic counselor and develop what is called an academic plan. An academic plan is going to help you put into order of sequence the prerequisites and any graduation requirements, whatever is necessary for you to get out with what you want to get into, to get out of Tri-C correctly and to expedite the process, make it go as quickly as possible for you. They'll work with you on, if you want to take part-time courses, they'll work with you on campuses. As far as I want to take, I work downtown and I want to take courses at Metro, but in the evening I want to take courses at West because I live in Strongsville. Whatever the case is, they'll work with you on scheduling the right schedule for you to get your courses done. You can do that scheduling of counseling appointments online at that website. I mentioned the tridic.edu/HC. That gets you to the form, the start form, the start page, which gets you into our system and gets you connected with the areas that you're interested in so that you're not off just wandering around, wondering what you're going to do next. That should never be the case. Health profession student recruitment specialist. That is I, Bob Madison. I operate best on email because sometimes I'm at, it's 10 o'clock or 11 o'clock at night and I'm doing emails. And I'll send an email at 11 o'clock at night. I would never, ever call somebody back after, a certain time. So emails work best for me to contact. I do in-person appointments at Metro and West Campus. So if you want to make an appointment with me and talk about any of the things you heard today, make an appointment with me. We can do it via WebEx, also a virtual appointment. But I like in-person appointments because I can gauge where your questions may be. Maybe you don't know what questions to ask, and I can help you with that. And so I take appointments at Metro Campus and at West, and I can meet you where you're at, and we can get you going in the right direction. We want to get you back into the fold. I'm going to get out of, I don't think that that's the end of the slideshow. I'm going to get out of the sharing of screen if I can. And the slideshow, there it is. Am I back on camera?
It's still showing your presentation, but that is okay. What I'm going to do is sharing final reminders. And thank you so much for sharing your contact information and letting everyone know that you are able to meet with them in person and via WebEx. And in that way, they can learn more about these opportunities. So thank you so much, Bob. I learned so much. It is amazing. All that everyone can learn. Sometimes we hear about this, we hear about that, but it is good to connect with a recruiter that can help you go through all those programs and requirements. Definitely a wonderful presentation. So I just wanted to remind everyone that we are having spring registration will begin in next week. We are having a spring registration, and if you have not reapplied, we encourage you to reapply. We want everyone to start planning as soon as possible. It's never too soon to start planning. The sooner you start planning, the better. It's easier for you to find a good time, good schedule, the days that work for you, and also to meet with a recruiter or someone in the counseling office just to discuss your academic plan. Again, start planning now, and class registration will begin next week. Here is also my contact information. Feel free to email me if you have any questions. I will be happy to connect you with our recruiters. I will be happy to share more information about any other requests that you may have. And that's all that I wanted to share with you. Thank you so much. And I'm looking forward to connecting with you soon. Thank you so much, Bob, again. I love all the information you share. And we are looking forward to connect with everyone and help them come back to Tri-C, stay, and of course, graduate to celebrate with them. So thank you, everyone, and have a wonderful the rest of the day. Bye-bye.